the different things that are happening. This particular virus that we've been going through as a country has been an extreme challenge, making sure that people are staying socially distanced, that they're staying home, they're making sure to stay safe. And it's a lot of challenges, and not just for the physical challenges, but much more importantly, the mental health challenges. So having Commissioner Michael Orth here to discuss the things that are happening and give us some options and discussion points around COVID-19 and how we can keep our mental health and well-being, as well as keeping everyone safe and sound, is a great thing. So Commissioner Orth, thank you for being with us this morning. We're over a month into the coronavirus epidemic, and we've all been impacted in many, many different ways. What thoughts and recommendations do you have in terms of us coping and self-care?
Well, thank you. And thank you for having me. And I appreciate your leadership, our county executive's leadership during this challenging time. And I hope you're all well. Clearly, we're all impacted and feel the effects on our emotional wellness. Of course, everyone reacts differently to different situations. And we know it's normal to feel stress and worry during a crisis. The effects of COVID-19 pandemic can push you and us beyond our ability to cope. I always like to begin by reminding there are things that we can do, there are self-care practices that are important that we all practice on a regular basis. Some that involve exercising, making sure we enjoy safely the outdoors, focusing on our nutrition, not too much comfort food, really balancing the healthy foods, getting appropriate sleep. And by that, it means getting the hours that you need, but not sleeping too much, because that also can be a sign of depression that we'll talk about later. Staying connected in safe ways, the use of technology, and especially for those working remotely, trying to have some safe spaces away. Sometimes working remotely for too much news is sometimes a little bit overwhelming. So creating some safe spaces within your home or within your environment. One thing we often talk about is also being cautious of your alcohol consumption, recognizing that for some it's an issue or can lead to an issue. So being aware of that. And just as we talk about physical exercise, we also want to take care of our mental wellness. And there are things that are very simple that we can do that are very grounding, doing some journaling or mindful activities that help us stay focused and present in the moment. So those are some self tips that we often talk about. But the reality is that we are all experiencing stress, anxiety, a bit irritable at times, and fatigue. And give yourself permission to feel some of those emotions. It's normal, but one thing we often suggest that if the signs and symptoms last for several days, or it's impacting your normal routines and functioning, and irritability may turn to violence, or the alcohol use or substance use is helping you cope, it's important to get help. And as we all know, there is help out there, and please do ask for help if it becomes a point where you're experiencing major stressors.
Well, and those are great suggestions. One of the things that you just mentioned, you started with was creating a safe space. I mean, I think that one of the challenges right now, since it's coronavirus all the time, news, and you can get into a particular cycle when no matter what station you're flipping through, and you could get locked in and looking up on the internet and being involved in social media groups and seeing those kind of things. When you say safe space, give us an example of what you mean.
Well, safe space also means obviously physical space, but also space in your mind. And one of the things we often talk about is just being in the moment and staying present. Whether you're smelling something or focusing, the sensory, stay present. Don't think too far ahead, because we know if we're thinking about the future, it can lead to more anxiety. So try to be in the moment, not only physically, but also emotionally and mentally, and be aware of your surroundings and really just feel that. That helps you create a safe space, both physically and emotionally.
Oh, awesome. Thank you so much. Can you briefly let us know what's going on with the things that are under your control and your administration as far as our mental health delivery system? Are our services still open? Can people get the help that they need?
Yeah, well, thank you. And there's so many heroes behind the scenes. We talk about our first responders, of course, our police and healthcare. There's also agencies and staff in the mental health and substance use system who are reporting to work. Our psychiatric hospitals are open, many of our community-based organizations, our clinics, our childcare and adult settings where people are coming to work every day to care for those who need the support. So all of our essential services are open. All of our outpatient mental health and substance abuse clinics are primarily working remotely, and they are accepting referrals. So if you're someone who's never engaged in services and really feel that you need that support, services are available. Also, during these challenging times, we create new partnerships, and the Westchester Citizens Therapists are a group of clinicians who are offering pro bono services for those who are experiencing challenges with the COVID-19. And if you call our main emotional wellness hotline, 995-1900, we can connect you to therapists who have varying degrees of experience, who have specialties in trauma, working with younger people, working with seniors. All those folks are stepping up and really supporting our residents. So there are services out there. We also have to be aware and mindful of certain populations that we want to make sure that we're connecting with. People with pre-existing mental health or substance use issues, and this may be triggering something in terms of relapsing or some other underlying mental health issues. So we want to make sure those folks are connected. Of course, our young people who are experiencing, just as we are, some trauma. The routine has been disrupted, so staying connected to young people during this challenging time. And of course, our seniors, many who are isolated and really need us to reach out to them to make sure they're both physically healthy, but also mentally staying connected to us. And of course, during these situations, we have to focus on individuals experiencing domestic family violence. And how can we make sure they're reaching out to us or have opportunities to get the support that they need as well. And we also have our healthcare staff who are going through so much, working long hours, doing what they do well, and how do we connect and support them. So we've created these channels of communication support, really trying to stay connected to those groups that really need our attention. Some of the exciting partnerships that have come out of this, and again, a lot of it is challenged because we're working remotely in many cases, is our police department. They're on the front lines. They're dealing with situations, some that they're not always used to dealing with or have seen a rise in support. So we have people who are, during this crisis, experiencing mental health issues, maybe because they're irritable, becoming more violent, that our department under leadership of Mark Giuliano is connected with all, I think it's 42 plus police departments, where they have with them assigned Department of Mental Health staff that are available at that point in time to triage, to work with people who may be challenged or experiencing a crisis, so we can support them on the spot. So it's creative opportunities like that we want to support our citizens. We've also been working closely with psychiatric hospitals, with Department of Social Services for individuals who may have housing challenges and also experiencing emotional distress, just like many of us are, and triaging with those various departments to work together. We've also worked closely with our school districts and our BOCES. They've really stepped up to the plate, and we're offering trainings to not only school districts, but to parents, trying to be creative in how we engage our students as well. So it really has, people have stepped up, and we're making sure that we're all connected and that our emotional wellness is being addressed.
Well, and that was some awesome things that you just mentioned, whether it's from the school districts, whether it's Department of Senior Services, Social Services, and all those things. They can get to all of those things, though, if they call you to make sure in your department. And the number you gave was 995-1900 to that those individuals, and certainly for those that are internet connected, is the DCMH at .westchestergov.com.
Yes, it is.
Start all those services, and you have an outstanding guide online for individuals to utilize. Can you talk a little bit about that?
Yes, we do have a guide that can be connected through westchestergov.com, link onto mental health, which is a list of all of our mental health, substance use, and developmental disability services. It can be you can get it online. It does some GIS mapping, so you can actually look what's closest to your location. But again, as the Deputy County Executive said, call our emotional wellness line, 995-1900, and we'll help you connect to whatever services you may need at that point in time.
And it was very important, as you mentioned, about talking about the essential workers, some of them being first responders, some of them being nurses and doctors that are on the front line. And a lot of them have their own mental health challenges as well to try to get through this, because, this particular scenario, and if you could talk about this for a minute in context, because there isn't, an end line. When we have a storm or we have something that happens, we normally see, the storm happens, a tornado comes through like it happened in the South yesterday. And there's the trees down, power lines down here in Westchester, that's the case. And those things, the road gets cleared, the trees get removed, the lines get put back up. That's a period of time. It's not, as we've been doing this in Westchester County from March 3rd and continuing on to today. One of the challenges, again, is balancing those mental health for those individuals that are essential in front lines. Can you talk about that?
Sure, that's really an important facet of the support that we provide. And as you know, during these situations, just the adrenaline kicks into a lot of these first responders, and they're in the midst of working with people who are in distress. And what we've done in some of those sites is create sort of a wellness kind of respite room where folks can just take a breath, come in a very mindful environment. Some folks just put their head down. We've actually handed out coloring books, and some people just color to just get their mind distracted for a few minutes, and others just talk. They share what they're experiencing, some of their concerns, and we do some very simple breathing exercises, just some mindfulness. It takes 2 to 3 minutes just to get folks grounded, thinking about their own wellness, and just connecting. That's something that's not related to their day-to-day work. So we've offered some of those trainings remotely. We're going to be posting several tips on coping, and we're actually going to be doing a workshop Thursday that's open to all Westchester residents that really gives us some exercises on mindfulness and staying grounded during these challenging times, and something that we all need to practice, whatever form we're most comfortable with.
Well, and one of the unfortunate challenges in this, and especially given all of the other constraints that we have at this particular time, is unfortunately the loss of a loved one or a close family member. And the process of grieving is challenging on a normal basis, and everyone grieves differently. In this particular time, there's some additional challenges because people can't support each other the way they want to. I know I'm a hugger, that's just who I am. And the whole social distance, elbow bumping thing, and reduced sizes of even services, it doesn't give people that kind of same thing. Do you have any suggestions around that?
Yeah, that's a really good point. And unfortunately, the sad reality of what we are experiencing is that many of us have perhaps lost loved ones. And as you indicated, with social isolation, distancing, that we can't utilize the traditional ways of grieving and mourning, and whether it's sitting Shiva or attending funerals. And we've also experienced some folks who've called with sort of a sense of guilt that they weren't at the bedside of a loved one, or they couldn't say goodbye to someone. And those are real situations, and we really hope that people can find a way to grieve and to mourn. It's extremely important. And there are ways of doing that remotely or connecting. We recently just spoke to someone who did a remote kind of funeral and memorial for their loved one, where they invited family members and friends to do it, of course, remotely. And while clearly it's not the same way or that they're used to, it did allow for a sense of connection, of support, and recognizing that individual and celebrating their lives. So there are ways creatively by using technology, of course, for those who have that ability to do a technological. We are able to provide any supports. Many of our pro bono counselors are grief specialists. We're also fortunate in Westchester to have the Bereavement Center of Westchester, who are doing remote grieving bereavement for children and adults. So if you call our emotional wellness phone number, we'll definitely connect you to some of those services. And there's also the faith-based community that we've been very connected to before and during this epidemic, who are doing a lot of their counseling and supports and faith-based work via the internet as well and through technology. So there are ways of connecting, and it's important that people do mourn and grieve.
Well, the last thing again, Michael, and thank you, Commissioner Orth, for sharing all of the thoughts that you had and all of the resources. Can you go through a set of those resources just again, so that we can make sure to get those to the folks that are paying and watching us today?
Yeah, thank you. And the most important thing that we really want to communicate that it's okay to ask for help. You know, we all at some point in our lives, we go to the doctor for various issues, and we're going through a difficult period of time, and there are resources out there, there are options out there. So please don't hesitate reaching out to any support that you find most helpful. As we mentioned, we do have a emotional wellness phone line. The number is 914-995-1900. And you will have a professional who's going to answer the phone. We've gotten over 100 phone calls in a very short period of time. Some people just looking for tips on how to talk to their children about COVID-19, who want some information on mindfulness. But we've also gotten referrals for people who need to talk to someone. It may be the first time they've engaged in any form of treatment or counseling. So we will connect them to one of our agencies or to one of the clinicians on call. And we hope people take advantage of that resource. For some, it may be time limited. It just may be a few phone calls to help them learn coping skills during this very challenging time. We also have created virtual educational forums, mindfulness forums. As I mentioned, we will be hosting a workshop on Thursday at 2 o'clock called Mindful Work-Life Balance and Practical Steps to Integrate Mindful Moments and Guided Meditation. We'll also be taping that and putting it on our website. And we have a Buddhist practitioner in White Plains, Calvi Granalsos, who's a Shinto Buddhist priest, who will be leading us through this exercise. And it's very practical tips, why it's important to be mindful. And then he'll walk us through a few simple exercises that we all could benefit from. We'll also be posting through Westchester Citizens Therapist, just simple tools about addressing anxiety, coping skills that's available to the public. Our agency, Westchester Jewish Community Services, is also doing Wednesday parenting sessions. And through the Harris Project, they have a special toolkit for student athletes who may need some more support during this period of time. So the main thing is call our number, 995-1900, and we'll connect you to whatever services and resources you may need.
Well, and again, as we've been going through this challenging time, and certainly County Executive Latimer has been making sure to get this information out and reaching out and talking to the different commissioners and various work groups and letting them know that, you know what, one of the best things, as you said, none of us has the answers on this particular thing. So reaching out to the support as community mental health at the wellness hotline, the 995-1900, going online at westchestergov.com, clicking on the link for community mental health, and to be able to take advantage of all of those opportunities. And again, there's been things, our parks are open, to take that walk, socially distant, of course, but making sure that you're wearing your mask and keeping yourself safe and walking through the park and just being able to get out and be able to take advantage of the things. Any last things that you'd like to share, Commissioner?
Yeah, I think it's important, and thank you for having me, that this will be an ongoing journey. That's important that we stay connected. This is not a side issue. This is an important issue. And I always quote Dr. Brock Chisholm, who was the first director of the General of the World Health Organization, where he quoted as saying, without mental health, there can be no true physical health. So they go hand in hand. Our physical and mental health are both extremely important, and it's important that we take care of it, we nurture it, and get the support that we all need.
Well, thanks again, Commissioner Michael Orth, Commissioner of Community Mental Health. One day we'll rename that to something different because you do so much and so many works there. Thank you and all of your team that's doing the great work. Westchester, continue to be safe and to make sure that we're practicing good social distancing, making sure that we're staying in as much as possible, because this is something that's very important for all of us to make sure that we can get to the other side of that. But to get to that other side, we need to make sure to take care of our mental health. So thanks everyone for watching, and we'll see you on our next opportunity to speak with you. Thanks again.
Thank you.